So there are a lot of reasons for stroke, both because of decreased blood supply or because of bleeding in the brain, and the most common causes which we see in the general population is high blood pressure, high diabetes, some patients with kidney disease, and also in those who are addicts, especially tobacco and alcohol. But nowadays, in the last decade or so, we are seeing strokes in a lot of young people. Most of these patients tend to be the ages of 40 or less. And in these patients, we have seen stress plays a very important role in causing stroke. Stress leads to increased blood pressure, increases their cholesterol. These are patients with type A personality. They tend to sleep less, tend to skip meals, don't exercise well, have a very poor lifestyle with smoking, alcohol. And all this added with stress adds to the risk of having a stroke, especially in those who are very young. So most of the strokes that we see in the general population are because of risk factors which we see because of the diabetes, because of blood pressure, and in some patients because of kidney disease or because of addictions. But there is a very small subset of populations, probably less than 5%, where strokes can be genetic, and genetic strokes tend to occur in those who are very young. These are patients who are actually in their first or the second decade of life. And there are some conditions which are called connective tissue disorders like the Marfan syndrome, Ehlers-Danlos syndrome, or there are certain substances which can accumulate in the blood like homocysteine, and this can be a hereditary factor, and high homocysteine can actually lead to strokes. So hereditary causes of strokes do exist, but they are very rare as compared to the more common causes like diabetes and blood pressure. The window period for giving the blood thinning injection is in the first 3 to 4.5 hours. But there are a group of patients who have either not been able to identify that they have a stroke and hence reached the hospital after 4.5 hours, or there are some patients who actually went off to bed normal, but when they wake up in the morning, they find themselves weak on one side, and we don't know how much time has elapsed from the stroke. So in these patients where the time is more than 4.5 hours after the stroke, still there are treatment options available, and here it's not in the form of an injection. We urgently do a test called an angiogram, which is either a CT or an MRI angiogram, and if there is a blockage of a main blood vessel, just like you do angioplasty and angiographies for the heart, we take them urgently to the angiography room. We put in a wire through the clot in the brain, remove the clot, and try and establish a circulation as quickly as possible. So even if you reach after 4.5 hours, but you have come without any big stroke in the brain on an MRI, if we do this angiography procedure, your outcome will still be good, the recovery will still be good. The importance of reaching the hospital on time for a stroke cannot be overemphasized. Time is brain, because with each minute that you lose with a stroke, billions of neurons will die. In fact, if you are late by coming to the hospital by even half an hour, you have already aged in terms of brain age by 3.5 years. That much amount of brain tissue is already lost. So, time is brain. Identify stroke symptoms as quickly as possible. Don't wait for these symptoms to improve. Don't wait. Even if these symptoms have improved completely, reach your nearest stroke-ready hospital, because time will definitely save the brain and will improve your outcome.